Hi, this is Barbara Howard, here to talk to you about CHADIS for pediatric specialists. I'm a developmental behavioral pediatrician on the faculty at Johns Hopkins, and so is the co-creator of CHADIS, Dr. Raymond Sterner. We've created CHADIS as a clinical process support system to help with all aspects of pediatric care. Before the visit, patients complete questionnaires. Within the visit, doctors get moment of care decision support, and after the visit, patients get patient-specific education, and clinicians have access to additional educational materials. So CHADIS was developed with almost $19 million in NIH funding since 2001. We have current grants for social determinants of health, teen depression, and teen substance use prevention. But over 2 million patients have enrolled in CHADIS, and over 100,000 patients per month complete questionnaires. Currently, CHADIS users are in 49 states and 10 countries, with over 8 million questionnaires submitted. CHADIS is a highly secure HIPAA and high-tech compliant system. It's even FERPA compliant, which is the school system's HIPAA. CHADIS is integrated with a number of electronic health records, including Allscripts, TouchWorks, Allscripts Pro, Office Practicum, Athena, eClinicalWorks, and Epic, and we have a planned integration with MicroMD, as well as one-off installations with Cerner and Centricity. So we know that academic pediatricians, because we are academic pediatricians, see specialty patients, and that those patients actually have higher rates of developmental, mental health, and family stress issues. Children with chronic conditions are actually less likely to receive routine screenings for problems like these in primary care settings. The children with chronic conditions also make less progress if their mental health and family issues are not adequately addressed. We also know that specialists have multiple demands on their time. They need to take care of patients, teach, and conduct research simultaneously. CHADIS can help with these things. CHADIS will program your custom research tools to be delivered in the course of care by the CHADIS system. It collects research data that's submitted online through CHADIS by patients, and also supports staff entry into forms that can be created for you. It provides online consent forms that have been approved by several different IRBs to make it easy to consent patients for your studies without requiring a research assistant. It reminds patients by text or email to complete questionnaires between visits or to collect outcome data. Even reminding them the number of times that you allow it to do that. It forms a database with this information without any research assistance to do it, and that's available for your analyses. It automates statistical control charts and other kinds of graphics, and even provides point-of-care learning for your trainees when they're not busy seeing patients. It delivers patient study information and education to individual patient care portals as well. So the CHADIS process is really easy. The office or entity sets up automatic assignments of which questionnaires from the over 500 questionnaires you want the patients to receive, and they get a single invitation code, register themselves and their child, and complete the tools. The clinician can then see the scored results and graphics and conduct a visit with shared decision-making. If this is a researcher, they can see the scored results and graphics for the use in research. Patients can then access patient-specific education and resources in individual care portals. CHADIS already has over 500 tools in CHADIS, and we can customize tools by your request. As you can see here, they cover all kinds of general medical problems, developmental and mental health issues, and even educator tools, tools for clinicians to complete, consent forms, and quality monitoring and satisfaction tools. I can send you a list of tools specifically by your request. You can also see them on the CHADIS.com website. So let's talk about the step where parents, teens, and teachers complete questionnaires. They can do this on any internet-connected device. We found that lower-income families most preferred tablets, but nowadays everyone has a smartphone, and that's a great way to do CHADIS. Patients can choose English, Spanish, French, and in a few cases Chinese to complete questionnaires, and there are no browser or hardware limitations. The view of the questionnaires as you can see here for the ASQ, is just as it would appear on paper. They simply click the radio buttons to submit their answers. They can also see questionnaires in a tablet or kiosk view, one question at a time. And if they click the little link there that says Cambiar al Español, it will change the questions into Spanish, but the results come back to the clinician in English. Clinicians then review the results and decision support. This is an example of a clinician page of report. At the top, you see the patient's priorities for the visit. In the table, you see what questionnaires were submitted and stars or asterisks for the severity of results. You can also see pass, borderline, or fail, disorder, problem, variation, or challenge here. Below that is a summary for the questionnaire, including the scores. And we also have some automated follow-ups. This is also the view of the questionnaire results with the individual questions and responses provided. That's true and available for every questionnaire. Now, one of our special features is the MChat follow-up. This is an example where the patient can the doctor, can click on the CHADIS MChat follow-up and is automatically presented the questions that they need to answer for a valid follow-up to be done for the MChat. This is the way that the MChat is recommended to be used. And we have published a paper in Pediatrics showing that pediatricians with 10 minutes of training can do this, as well as a research assistant in an autism center. We've actually done a lot of research on autism, starting out with that study about the feasibility of the MChat follow-up. But we, along with others, have discovered that the MChat does not work well at 18 months. We determined that dimensional items, asking how much, not just yes, no, is helpful. We found that the 24-month version using the MChat follow-up was accurate, much more so than the 18-month version, but that there are limitations for the MChat overall, even without the MChat follow-up. And we've also created the most accurate autism screen at 18 months using machine learning. Here's an example of that last item. This is the current standard tool for autism determination, the MChat-R. This is a screening tool. The gold standard here was a gold standard ADOS test as well as a Mullen. You can see that the sensitivity is pretty good, but the specificity is subpar, and the positive predictive value is only 0.28, whereas the machine learning method using CHADIS had a sensitivity 9.4, specificity 0.87. Positive predictive value was almost 3 times as good at 0.58, and developmental delay was also detected using the same tool at levels that were higher than those of the ages and stages at this age. Combined for either an autism or developmental delay finding, the tool is exceptional, 0.94, 0.81, and 0.67 for positive predictive value. Now, some of the features of CHADIS include tools for shared decision-making, like this graphic for the ages and stages, where the scores appear in the band of typical monitoring or referral. You may know that the ages and stages has different cut scores at each age, which otherwise makes it somewhat hard to visualize the results over time. We also have a cool way of looking at the Vanderbilt over time, where the parent did the Vanderbilt at 2 different times, and the teacher also at 2 different times. The green is best and red is worst. Green is good, red is bad. We all know that. And any yellows or reds above the cut line indicates significant symptoms for inattention or hyperactivity. This kind of tool is great for shared decision-making with patients, and parents and teachers can be invited by email through CHADIS, either initiated by the office or by the parent, to get the teacher to submit this information. Here's an example of a tool over time. This is the PHQ-9 showing how the patient's doing over time. We can do that with any tool now that has a score. For asthma, we both show a mountain range score and color graphics. Green is good, red is bad, showing how the patient is progressing in terms of their severity control ratings from the Pediatric Asthma Control and Communication Instrument. This is the tool we used in our asthma study with a tool that we developed called the patient-specific template. Now, this is a way of producing a template, and you all have templates in electronic records, but this one is different because it incorporates and is pre-populated by questionnaire results from multiple respondents. It shows clear next steps tailored to the patient's situation, coaches the doctor on problem-solving counseling for any problems with adherence, provides an e-chapter from NHLBI guidelines for decision support, and makes a graphic depiction of the asthma results over time, as well as providing automated chart documentation and a tailored pre-filled asthma treatment plan for each patient that can be modified remotely. It even sends messages to patients reminding them to do a tool between visits and assigns them automatically asthma-specific education resources, including things like videos I'll show you in a moment. So here's the doctor view. There's that graphic I was showing you before. You see that the tabs reflect the things that should be covered in an asthma visit, but in this case, the next steps for this specific patient are here. Because the adherence went from 75% to 50% here, the first thing to do for this patient who's got worsening control is to address adherence. And if they click on this link, it takes them to additional coaching for additional coaching for how to manage the asthma. In the meantime, the report has been written over here on the right automatically by the computer. Here is an example of an asthma help video, which shows correct inhaler and spacer use. And scheduling these or making ad hoc reminders to do interval questionnaires allows you not only to get data from multiple respondents who are remote and update the asthma treatment plan, but it's also billable under a monitoring code 96910. The results of a national cluster randomized control trial with 24 practices and almost 5,000 kids, comparing people who had access to that patient-specific template and reminders compared to typical care where they had access to CHADIS and they had access to the Apache tools but not the decision support, showed that the intervention group patients had significantly fewer asthma attacks, less rescue medicine and steroid bursts, fewer asthma visits, more children appropriately on the right controller medicine for their level of severity, more children with stable asthma control, a trend towards fewer ED visits and hospitalizations. So all of that is good, and this tool is also paid for by insurance under 99091. Patient-specific education and resources are an important part of CHADIS, and these things appear in individual web pages for the family. So it's called a MemoryBook because the items from the ages and stages, which are developmental milestones, appear here, allowing parents to add pictures or comments, but also to access suggested activities to promote the child's development. The CDC paid us to build this because of these flags for safety issues that are not being properly addressed by the parent based on their questionnaire results. So here's an example of a suggested activity for a child who can do this. Here's some more things to do with them. And on the Notices tab, you see personalized notices for safety alerts, including safety information on what to do about it. These are all in tune with Bright Futures. On the Resources tab, patients can see listings of resources, agencies, books, handouts, etc. that are sent there automatically or because the doctor chose them. The patients can also search in the resource database and see things for themselves with no advertisements. This is an example of the kind of handout that would be available in the care portal or could be printed. In terms of clinician support, one of the things that we're particularly proud of is the fact that CHADIS is the only IT company, health IT company certified by the American Board of Medical Specialties to provide Part 4 maintenance certification for any specialty, pediatrics, family medicine, internal medicine, psychiatry, just being examples. The data is generated by the patients and doctors' decisions that are logged into CHADIS and requires no chart review to get your 25 credits per program with only 3 one-hour webinars and a quiz. This is an example of a run chart that will be shown to you during those webinars. Reliable change charts for quality improvement and research can also be automatically generated by CHADIS data, and this is very helpful for researchers and people who are concerned about quality improvement. CHADIS is a perfect system for integrated behavioral health care because there are tools both for primary care providers and for mental health providers, and primary care providers can share data one at a time per patient or their whole panel of patients with a co-located mental health provider, depending on their permissioning. We also have a great deal of mental health support for mental health training, for primary care providers included in CHADIS, and referral functionality to community resources. Now, what do I mean by this? Well, in CHADIS, an online consent form appears that allows patients to type in their name, giving permission not only to send referral information, but also to give permission for the agency to contact the patient and to report on the status of the referral, whether they kept the appointment or not, and to share data back securely. So this is an exciting new development, which is being used now in the system of care. I'll tell you about in a second. CHADIS can produce a registry for you of any data you want, because of course it's a digital system. And this information is being used now in Montgomery County in a program to provide a system of care for autism and developmental delay, where parents complete the tools, the PCP sees the results, refers the child via care coordination functionality, the specialist gets the referral and follows up with the patient, sends the results from the specialty evaluation back to the primary care provider. So this is the ideal cycle of care, not just for autism and developmental delay, but for other kinds of referrals as well. Keep in mind that you can actually make money for your hospital or your practice using CHADIS, because many of the tools are billable under these insurance codes. This is the national average of how these are paid, and you can see some of them are actually quite significant when it's a diagnostic tool. And it adds up to between $15,000 and $30,000 per doctor per year for full-time practitioners. The complete CHADIS package includes hundreds of questionnaires, the patient-specific templates, the CHADIS e-textbook, which is great for educating your students and residents, and parents' handouts are actually good educational materials as well. The resource database will add your local resources, the MemoryBook care portal for your patients, unlimited customer service, and online office admin training. There are a few tools that are a la carte. There's a small extra fee for the MOC4 program and QI run charts, as well as practice data dumps. I hope you find this intriguing and will get in touch with us, info@chadis.com, or you can email me directly, bhoward@chadis.com, for more detailed discussion about your specific needs for clinical work or research. Thanks very much.